So, is the Medicare Advantage plan driving small rural hospitals out of business? Well, according to a segment last night on the NBC nightly news program with Lester Holt, the answer is yes. I happened to catch this segment accidentally, and I knew this was something I would want to share on my YouTube channel. So I'm going to share a little bit of it with you. I'll share some comments along the way, and then I'll wrap up with some of my thoughts on the story. If you want to watch the full video, I'll leave a link to it in the description of this video. So stay tuned.
We're back now with our NBC News investigation into Medicare Advantage, those Medicare-approved plans offered by private companies. Millions use them, but we found they routinely reject claims for necessary care. As Sam Brock reports, it's devastating hospitals in rural America.
This was once the geriatric psychiatry unit at Alliance Healthcare in Holly Springs, Mississippi. Now the hallways hollow and beds sitting empty. This operating room only a few years ago was doing 5 or 6 procedures a day. Now, 0. Dr. Kenneth Williams is the CEO. He says the hospital can no longer afford the unit or any inpatient care for that matter. All of this used to service people that really needed help, and now it's just totally empty.
It's empty, it's gone, and it died the last few years with Medicare Advantage.
Medicare Advantage is a private alternative to traditional Medicare pitched by celebrity spokesmen like Joe Namath.
Medicare Advantage plans have added new benefits.
31 million people are on the plans, which are often cheaper than Medicare supplements and promise better benefits and lower premiums.
So the one issue I'll take up with this particular checklist that they put on this board is it says plans cheaper than Medicare supplements. What they're talking about here, I think, this is just my opinion, is the lower monthly premiums, not necessarily the overall cost of that health insurance policy. In my experience, people come to me and they ask me about these plans because they've been marketed to so heavily, and they say, what about these plans that have these extra benefits like vision, dental, hearing? And I routinely ask them, do you know which plan that you have? Many of them don't know. And do you know where the summary of benefits or the outline of coverage is? Many of them don't know that either. And if I really go deep and say, what is the co-payment on a stay for you with your Medicare Advantage plan at a hospital, they have no idea. So I understand what they're saying, and he says it here in the third point that it has lower monthly premiums. But when you're talking about the cost of your health insurance, you have to take into consideration not just the monthly premiums, but any out-of-pocket costs that you might have.
But the CEOs of rural hospital systems in 6 states tell NBC News Medicare Advantage routinely denies reimbursements for necessary care.
2006, we went from being well in the black to losing $1.7 million.
So one thing people may not know is that the Medicare Advantage program started much later than original Medicare or traditional Medicare. The Medicare Advantage program actually came into being in 2003, which is probably why by the time 2006 rolled around, they started to really feel the effects of it.
Overnight, Medicare Advantage. And all of a sudden, we went from smiling to crying. And nothing changed other than that.
One government report found the top Advantage plans denied payment for nearly 1 in 5 claims that met Medicare rules.
Your fight is not just to take care of patients anymore. Your fight is becoming more to get paid from the insurance company.
And without the resources to push back, rural hospitals like Dr. Williams's are forced to eat the higher costs.
All right, so I'm not going to show the whole video again. I'll leave a link to it in the description of this video, but let me just close with a couple of my own thoughts, because a couple things. One is there's a lot of news regularly around Medicare. There's a lot of politicians who talk about Medicare. This is a very hot topic politically. So whenever you're listening to a news story or a politician talk about Medicare, just keep in mind that you may not get 100% accurate information. I have a video that's doing really well on my channel right now that's talking about why Medicare Advantage isn't a scam. And the reason that I say it isn't a scam is because it was put together by our government in 2003. It is a legitimate program. However, I also say you have to really do your due diligence to know how the plan works. As I mentioned before, most of the beneficiaries I talk to can't remember the plan that they have. They don't know where the outline of coverage or the summary of benefits are. And if you were to ask them how much a specific service would cost, such as a day stay at a hospital, inpatient hospital stay, or skilled nursing facility stay, they have no idea. Many of them, someone called them or they just grabbed the first plan that they saw. Here's the thing, even on the Medicare website, medicare.gov, they disclose to you, they show you in your area all the Medicare Advantage plans that are available, and they even give you the rating. And so you can see all the Medicare Advantage plans in your area on medicare.gov. You can see the Medicare rating that they have from 1 to 5. And so even that amount of research can go a long way to making sure that you have the right plan. The reality is this, in the Medicare supplement versus Medicare Advantage debate, it really depends on every person's individual needs. But I think what this story highlights is it also depends on where you live. In my experience as an agent, if you live in a larger metropolitan area, you have a lot more access to providers than someone in a very small rural area. That's just normal, right? Without the Medicare program. But when you add a layer of complexity to it, like the Medicare program, then it can become even more nuanced. So again, do your research when you're trying to pick your Medicare health plan. Make sure that you understand and go over the summary of benefits or outline of coverage with whoever you're working with. Know what the plan is going to cost you, not just the monthly premium, but any out-of-pocket costs as well. And obviously make sure that your doctor and is in network and your prescriptions are covered and all of that good stuff. So again, if you want to watch the full video, I shared about just a little over half of it. I'll put a link to it in the description of this video. If you have questions about Medicare, you can reach out to me through my website, get my phone number there as well, meetjay.com, or you can also leave me a comment. I'd be happy to answer any questions you have there as well. Thanks for watching. If you're not subscribed already, please subscribe to the channel, and we'll see you in the next one. Have a great day.